Let me introduce myself. I am Dr. Gautam Kodikkal and I am working here at Columbia Asia Hospital's Sarjapur Road in Bangalore. I have more than 30 years experience in the management and orthopedic surgery and almost about 10 years experience in the management of avascular necrosis of the hip. Avascular necrosis of the hip is an extremely distressing condition which unfortunately affects young people who are not really in the correct age group to undergo a total hip replacement. A total hip replacement is basically a replacement where the cup and the ball and the stem is replaced with an artificial hip. The artificial hips also have their own life, and therefore if you do a total hip replacement in a young person, it's not a very happy situation, because after 15 years, 10-15 years, they may need another hip replacement, and then after another 10-15 years they'll need yet another hip replacement, and each revision is going to become even more complicated. So do we have a system where we can save this situation and save this hip from a total hip replacement? Today, with the advent of regenerative orthopedics or regenerative cell-based orthopedics, we do have an answer, and we do have a situation where we can actually save a lot of these hips, especially if they come to us in early stages, from going to a situation where they need a total hip replacement. So let me explain to you a little bit about what is avascular necrosis. Avascular necrosis basically means that where the blood supply to the head of the femur gets stopped for various reasons. One of the common causes of avascular necrosis is steroids, and therefore recently, due to the advent of use of steroids in large quantities for COVID, we are unfortunately seeing a huge number of avascular necrosis post-COVID. Avascular necrosis basically means where the normal head, this is the normal head of the femur, and here is what happens, where the bone begins to die because of lack of blood supply, and it becomes dead bone. Now, because it becomes dead bone, it cannot support this spherical shape of the femur head, and the femur head begins to collapse and it becomes flat, and sometimes in the last stages it even becomes like a beak. Now, because it becomes like a beak, it is not a congruent sort of shape, so a normal hip like this slowly begins to degenerate, and as it degenerates it gets worse and worse, becomes more and more painful, and you end up in a situation where you have to do this, what is called a total hip replacement. So basically what happens is that the end stage of avascular necrosis is where the shape of the femur head is completely changed and it has become flattened out and it is not fitting properly into the cup. So what happens is it begins to cause degenerative arthritis, a painful hip, and in the end you require total hip replacement. So how do you treat this avascular necrosis, and what are the latest techniques which we can do to save this situation? Anywhere, if you go anywhere in the world, the gold standard for treatment of avascular necrosis is basically a procedure called core decompression. Now, core decompression is a procedure where you take an 8mm drill and drill into the area which has died out. So you drill into this, and after drilling you take a scoop and clean out all this dead bone, and once you've cleaned out the dead bone, then in the old days we used to just leave it at that. Now we found that 30% of those cases were successful, but 70% failed, and in the end this head collapsed and it required total hip replacement. So the question came in that how can we cause a regeneration of this area once we have done the core decompression and once we've cleaned out all the dead bone. So initially what we were doing is we were putting in some bone graft. After we put in the bone graft, we found that even this was not very successful. So we started putting in a strut of a bone in the leg called the fibula. So we used to use it as like a pillar or a strut. That also didn't work. So finally we started doing what is known as a vascularized fibular graft, where what we were doing is we would take the fibula and a small blood vessel which was supplying that graft would be attached to another blood vessel in the hip, and this was known as a vascularized fibular graft. This also didn't work too well. So then finally, when the advent and the knowledge of cell-based treatments came up, we started doing what is called as core decompression and putting in bone marrow. That is popularly known as BMAC. BMAC is bone marrow aspirate concentrate. So we started putting in bone marrow aspirate concentrate. Now the only problem with bone marrow is that basically it is the substrate or the base material for producing all kinds of cells in the body. So you are not sure if you put in the bone marrow how much of these cells are really going to form bone growing cells and add or cause regeneration of the head of the femur. So in fact, some research has shown that only one cell in 20,000 cells of this bone marrow has the potential to grow into bone growing cells, or what we popularly call osteoblasts. So what we started doing was, we found that if you can take out these osteoblasts, isolate them, multiply them, and finally come up to a critical mass of 10 million cells per cubic centimeter, and then inject about 10 cc of that into the core, or the area which you have cleaned out. So you inject it into this area, it causes regeneration of the head of the femur. Now this is popularly known as autologous osteoblast implantation. This is basically the most advanced and recent technique that is being used to treat this distressing condition. How do we do it? Well, what we do is, first in phase 1, we do what is known as a bone marrow aspiration. So we use a slightly thick needle and we put it into the hip bone, or not this hip bone, the pelvic bone rather, and we take out bone marrow from the pelvic bone and we send it to a lab, and the lab then isolates the bone growing cells or the osteoblasts, multiplies them, and then after 4 weeks gives the cells back to us, and then we do the core decompression and inject the cells into this area which we have cleaned out. So this is known as autologous osteoblast implantation. And in the recent past, we have been doing this for the last I have been doing it for 5 years. There are some who have even done it for 10 years. And studies have shown that we are getting excellent results. As I said, 75% of patients who are in stage 3 get excellent results, where they can avoid a total hip replacement. 90 to 90, maybe up to 95% of patients in stage 1 and stage 2 can be saved from a total hip replacement. So this is the latest and an extremely good treatment for saving your hip from a total hip replacement in this distressing condition called avascular necrosis of the hip. This is being done regularly here in Bangalore at this hospital, Columbia Asia, and we have done almost up to about 100 hips now with good results and excellent results in some patients. So this would be a treatment I would recommend if you have this distressing condition, especially as I said, unfortunately with COVID, the number of patients have definitely increased in the recent past. Thank you very much and stay safe and stay healthy. Thank you.